Hi, fellow future RNs. Today, let's talk about multiple sclerosis or MS and the Guillain-Barré syndrome or GBS. Okay, both of these conditions involves the demyelination or the destruction of the myelin sheath. Here we have an illustration of a neuron, which is the basic unit of the nervous system. So itong mga neurons na to, they carry information between brain cells and also they transmit electrical impulses from one neuron to another. Okay, so here, ang concern natin is the myelin sheath. The myelin sheath is an insulating layer. So yan siya sa dulo, sa pinaka, that's the myelin sheath. It's a covering around the nerves, including those in the brain and spinal cord. So ano naman ang ginagawa ni myelin sheath? So sa myelin sheath, it allows electrical impulses to transmit quickly and efficiently. Okay. CMS is a degenerative disorder of the central nervous system. Okay, ang problema sa MS is the demyelinization of the neurons. It is chronic, progressive, and non-contagious. CGBS, it is an acute infectious autoimmune neuronitis of the cranial and peripheral nerves. So mostly ang affected sa GBS is your peripheral nerves. It's characterized by the destruction of the myelin sheath. So parehong myelin sheath ang affected and it occurs a few days to weeks after a viral or bacterial infection. And si GBS, nagagamot siya, nawawala siya. When it comes to causes, CMS, unknown or it is believed to be autoimmune. Okay, so GBS, it's also autoimmune and the signs and symptoms are usually preceded by a mild upper respiratory tract infection or gastroenteritis. Anong nangyayari sa ating myelin sheath? Okay, first we have sa multiple sclerosis. Okay, so ito yung normal. So tingnan mo ang kanyang myelin sheath. Yan ang healthy na myelin sheath, no? So sa multiple sclerosis, ganyan yung itsura niya. Kasi diba, ang multiple sclerosis is autoimmune. So ang nangyayari, so hyperactive, no, yung ating immune system. So yung mga antibodies na to, nagpa-pass through sila sa ating blood-brain barrier o pass through sila doon at ina-attack nila yung mga myelin sheath. So, syempre pag in-attack nila yung myelin sheath, masisira, madadamage, si myelin sheath, magre-regenerate siya, no? Pagagalingin niya yung sarili niya, no? Tapos, kasi nga chronic ang MS, babalik at babalik doon yung mga antibodies at i-attack pa rin yung mga myelin sheath na nag-recover na. So, every time na nag-heal or nag-regenerate ang ating mga myelin sheath, nagkakaroon siya ng mga scarring, no? Nagkakaroon ng scars or lesions. Ang other term natin sa lesions or scars is sclerosis. Okay? So, kaya makikita siya sa MRI scan, makikita na maraming mga lesions ang patients na may MS. So, kaya siya tinawag na multiple sclerosis. Maraming lesions. So, sa GBS, ganito rin yung itsura niya, no? Damaged ang kanyang myelin sheath. Okay, so sa manifestations, sa multiple sclerosis, meron tayong fatigue and weakness, may ataxia and vertigo, may tremors and paresthesias. So, may problems din sa vision, no? Kasi pwedeng affected ang optic nerve. So, we have blurred vision, diplopia or double vision, and transient blindness. Merong mood swings and memory changes, and meron din mga bladder and bowel disturbances. And also decreased sensory sensation. So sa CSF, kapag nag-lumbar puncture na tinest yung CSF, ang mga possible na manifestation is increased, no, or elevated ang antibodies and protein kapag may MS. Okay, so other things na pwedeng i-manifest ng mga patients na may MS is the Lhermitz sign or the Lhermitz phenomenon. Kung saan ito yung kapag finiflex yung neck, no, ng ating patient, nafe-feel siyang shockwave sensation kapag i-finiflex ang neck. Okay, ang out of sign naman or out of phenomenon, ito yung increase or pag-worsen ng signs and symptoms ng patient na may MS kapag na-expose sila sa heat or kapag there is an increase in the core body temperature. Okay, sa GBS, remember, ascending paralysis. Kapag may nabasa ka sa board exam, ascending paralysis, madalas GBS yan. Okay, so sa GBS, meron ding weakness. Of course, weakness of the lower extremities. So, mag-umpisa sa lower extremities, pataas. Okay? May pain and hyper sensitivity. Meron ding paresthesias. May gradual progressive weakness of upper extremities. Again, yung ating paralysis, mag-umpisa sa baba, pataas. So, ascending paralysis. And then, kapag tinest naman ang CSF niya, elevated ang protein levels. Okay. Now, sa nursing considerations, let's start sa MS, no? First is touch eye alternately. Kasi di ba merong mga visual problems, may problems sa vision ng ating patient. So mag-patch ng eye alternately lalo na sa diplopia, sa double vision. I-promote safety of the environment kasi may weakness ang ating patient, no? Regular exercise and rest programs. And prevent exacerbations of attacks. Educate natin yung patient, no, kung ano yung mga possible na makapagpa-trigger ng attack, no. Ang tandaan natin is 4S. So, that's sun exposure, stress, sickness, and smoking. So, it can worsen the signs and symptoms. Initiate bowel and bladder training kasi yung mga bladder and bowel disturbances, and promote independence. Sa GBS, again, di ba, it's ascending paralysis. Mag-uumpisa sa baba, pataas yung paralysis. So, our major concern in GBS is difficulty breathing. Kaya dapat i-monitor closely ang respiratory status. Okay, so, ang ano natin sa GBS is treatment of symptoms. Again, ang GBS ay natitreat, no? So, nawawala siya. Gumagaling, okay? We monitor respiratory status. Pinaka-important kasi nga ang major concern mo is difficulty breathing. Okay, you prepare to initiate respiratory support. So, dapat meron ka ng standby, no, yung pinaka-important, meron kang standby dyan na for emergency intubation or tracheostomy, kung ano man yung kailangan. Assess for complications of immobility kasi may weakness din ng ating patient, and provide the client and family with support. Okay, so, again, yung ating MS is central nervous system. Sa GBS, mostly ang affected is the peripheral nerves, but both of them, ang problem is the demyelination and the destruction of the myelin sheath. Okay, so that's it for MS and GBS. I hope you learned something today. Bye!